Hey guys, Dr. J with Right Path Physical Therapy. Today we're talking about the abdominal brace, which is a little tricky, but a very, very fundamental exercise that we can incorporate into everything we do in life. Okay, so when I talk about the abdominal brace, I'm really talking about breathing here. A lot of my patients come into the clinic talking about how they need to get their core stronger, but most of America doesn't know how to breathe well. They don't know how to breathe correctly, and in doing so, if they could breathe correctly, you can actually activate that core so much better and have such better lumbar stability that you're not going to be in as much pain. So when we talk about the abdominal brace today, we talk about activating our core, what we're really trying to do is breathe correctly. So the majority of this video is going to be about breathing. We can do all those intense exercises that we do at the gym a little later down the road, okay? So get excited. Okay, so the abdominal brace. Now, if you're my patient, then we've already talked about it, and we've kind of gone into it, and you understand that there's a lot of little things to think about. We're talking about not only your core, or your six-pack muscles right here, but we're talking about the whole thing. We're talking about your obliques, your internal and external obliques. We're talking about your transverse abdominis, which wraps all the way around underneath all those muscles. We're talking about your multifidi, your rotatory, your erector spinae, the muscles in the back. When we talk about your core, we talk about all of these things that help provide lumbar stability, okay? And those are the things that we need to get kicked on and engaged, and those are the things that are oftentimes a little bit inhibited with people that are having low back pain or low back instability. So we're going to break the steps down of activating the core in this video. And I want you to follow along. Feel free to rewind, look at some stuff again. Hey, if you have questions, write them down in the comments or shoot me an email. I'm always happy to help. My goal is here to help you feel better, okay? Breathing shouldn't use any of the muscles in your upper chest. The only time we should use those muscles are when we're doing a hard activity, like running or any sort of cardio or lifting weights, anything like that, we're starting to use these muscles. But just living our lives, we shouldn't have pretty much any movement up here. So I want you to lay down again and take a big deep breath. Put your hands on your belly. I want you to take a big deep breath and feel your hands rise up. Good. Now put one hand on your chest and the other hand on your belly. Take a big deep breath again. I want your belly to raise up, but I don't want to feel any movement here in your chest. This is going to be really difficult for some of you. I totally understand, but this is foundational to what we're going to do here. And this is going to really help in the long run, okay? So, big breath, belly up. As you exhale, belly goes in, chest isn't really moving at all. It doesn't make sense, but really the mechanism of breathing is your diaphragm at the very bottom of your rib cage just pulls downwards, and as it pulls downwards, your lungs fill up. Okay, it's a bucket handle motion. Now, that's step one. Step two is I want you to, so you're doing a good job breathing into your belly, right? Good. Now I want you to take your hands and breathe into your sides. Can you take a big deep breath, not let your chest move, but let your sides come out into your hands? Good. Okay. How about putting one hand underneath your back, underneath the small of your back? Can you take a big deep breath and feel your back go down into your hand and kind of press your hand into the table or the bed? Now, this is the hardest one for most people, okay? And don't get discouraged. Think about one hand on top of your belly, one hand under your back, and I want you to try to expand the space between those two hands. For me, it doesn't happen until the very end of the range, until I'm kind of 75, 85% done with my breath, and then I feel my back press down and kind of expand. That's this big core that's expanding, okay? And imagine as you're filling it up, this is really important, that filling up is almost like, think about a Coke can and how easy it is to crush an empty Coke can versus a full Coke can, which is hard to crush, right? It's really solid. So imagine as you breathe in, you're filling up not only your belly, but the sides and your back, and you're creating this voluminous, wider Coke can in your core, and we're making a more solid area. And those muscles are actually activating as you breathe in into those areas. Okay? So, step 3. This is the trick one. As you breathe in, you're breathing into your belly, your sides, your back. As you do it all, feel that expansion in all those. And now I want you to hold that expansion. Can you gently push out into your belly, into your sides, into your back? Hold that expansion while you continue to breathe lightly. I'm doing it right now. It's going to feel a little bit firm. It's hard to hold that expansion. That's because you're using those muscles in what's called an eccentric fashion. Good. So keep pushing out and relax. Breathe into all those areas and push out. Can you continue to push out as you breathe? I practice by talking. So I'm talking right now while I'm pushing out. And that's how I know that I'm breathing. It's difficult. It's difficult. And what I'm asking you to do right now is doing it at 100%. But that's not what the research says. The research says that you only need about 10% of that engagement, of that activation to get the benefits of that lumbar, that core stability, that Coke can effect, okay? A canister is what we like to call it. So this is called canister breathing. And then I want you to maintain that canister, expand it, and then can you continue to breathe? Just breathe lightly while keeping that pushing out and into your belly, into your sides, into your back. This is really difficult. And sometimes it helps to come into the clinic so we can really talk about it and I can give you that physical, that tactile cueing. So you mastered step 1, 2, and 3, laying down. Step 1 is breathing into your belly. Step 2 is breathing in not only to your belly, but your sides and your back, breathing it all in, creating the canister. And then step 3 is being able to maintain that expansion while you continue to breathe lightly and regularly, okay? So once you've mastered all 3 of those laying down, I want you to try doing it sitting up. Can you breathe into all those areas? It might get easy. It's gonna get easy for you. It takes my patients 2-3 weeks generally to master this. It's not something that you get right away. Some people do, but it's hard if you haven't been doing it for a long time, okay? Now, I want you, if you get good at it laying down, I want you to then sit up and try to do it. And that's gonna be harder. And then, hey, if you get it sitting up, can you do it standing up? Can I do that? And then you can transition to doing it as you sit to stand, as you bend over and pick things up. This is that core stability we're talking about. And then we can start to do all sorts of fun core exercises. But this is foundational to doing all sorts of great stuff and to start taking your pain down. Again, this is Dr. J with Right Path Physical Therapy. Leave a comment down below, shoot me a text, shoot me an email. I'll be happy to answer any of your questions. We're here to help.